where there is so much information available to us, we tend to research everything. So perhaps if you're buying a new car, you read consumer reports, or perhaps you read online reviews when you're purchasing your next cell phone generation, iPhone, or perhaps you consult TripAdvisor regularly. Regardless of what that is, you take an interest and an active role in researching. So why don't we do that with our healthcare? So many times there are treatments or medications that are recommended or prescribed for us, and we don't research that. So how do you know if that's the most effective thing for you as an individual? I'd like to encourage you to be an educated, interactive healthcare consumer. Get educated on medications that are being prescribed to you, procedures, before you say yes to them, because not all procedures are right for every particular body. Doctors are amazing. I take my hat off to them. They certainly do a tremendous job of trying to facilitate your care. But in the 20 minutes that they're allowed to see you for an office visit, can they really get to know you as well as you know yourself? And that's a pretty tall order and a lot to expect from them. So what they're going to do is they're going to do what is normal to them, what feels right to them, what they've been trained to do. And that's often a pattern where they're going to go with what they know. And that's something we all do. That's what's familiar and that's what's comfortable. But that may not be the right choice for you. What I'd like to do is encourage you to research your facility where you go, the doctors you go, the treatments, the medications, and ask questions as they pertain to you, much like you would be researching your car as it pertains to you. Perhaps a low model sedan isn't what's working for you. You want to get that specific for your body. I work at Western Berks Physical Therapy. We're an outpatient orthopedic private practice physical therapy facility. So that means we aren't owned by a hospital, we aren't owned by a physician group, we're private. So what does that mean? That means that every single patient is extremely important to us, because if they don't have great outcomes, if they aren't well pleased, if they aren't telling their family and their friends and their neighbors and their co-workers how great they feel after coming to us, and if they aren't going back to their doctor extremely happy with the progress they've made or with their rehab, we don't survive, especially in this really ever-changing healthcare kind of environment that it is. Whereas a facility that's owned by the hospital or a facility that's owned by the doctor, they have a never-ending, self-generating supply of patients. And that's not to say you won't get good care there. It's just you are part of the process there. You're going to be moved through as a byproduct, as opposed to maybe being the most important thing that each of those individuals has to do that day. We need you to get better. We need you to have a good result. They don't necessarily have to do that. So I would encourage you, whether it's physical therapy, if you have a physical therapy prescription, it's much like an eyeglass prescription or even a prescription for your medication. I mean, you can go to Walgreens or CVS or Rite Aid or Walmart or Sam's Club to fill that prescription. Same with physical therapy. Your doctor may say, well, we have physical therapy in this office. Why don't you go here? The hospital may try to keep you in the hospital network, but that might not be what the best decision is for you. You might do much better going to an individual private practice. And so I'd encourage you to take that prescription and go to a place that's best for you. Research it. And if it's what's most convenient to go to one of those other offices, then by all means do that. But know what you're getting. Research what you need. And that would be my recommendation for you, not only for physical therapy, but for any healthcare treatment.